Hi, and welcome to this edition of Duffy Doings, our show about healthcare and homelessness on Cape Cod and what's going on at Duffy Health Center. Today, I'm very excited to talk about the 20th anniversary of Duffy Health Center. We have some wonderful guests here to talk about old times and the history of Duffy. I'd like to first introduce Cindy Glista. She's one of our nurses at Duffy Health Center. Our former executive director, Claire Goyer, and Dr. Hub Mathewson, we call him Hub, a pediatrician and an honorary board member at Duffy Health Center. Thank you all so much for being here today.
Thank you.
Thank you. So it was about 20 years ago, on May 16th, 1997, that Duffy Health Center was incorporated in the Commonwealth of Massachusetts. But legend has it that we actually started a few years before that in a broom closet at the Noah Shelter. Now, the Noah Shelter is now called St. Joseph's House, but back in the day it was called the Noah Shelter. And now look at Duffy today. In 2016, we served over 3,000 patients with about 30,000 visits. We have become a model of integrated medical, mental health, and substance abuse services and case management on the Cape. We've become a major treatment provider for the problem of opiate addiction, and we are now poised to join Massachusetts health reform through the Accountable Care Organization. So a lot has happened in the last 20 years. So Hub, let's start with you. Can you explain to the audience about the role that volunteer medical providers played in starting Duffy Health Center?
Well, it all started with volunteers. Basically, it was Susan Duenas, who was a VNA nurse, who would visit patients in the homeless shelter, Noah, that had been discharged from Cape Cod Hospital, either the emergency room or one of the inpatient beds. And she would visit there for dressing changes or blood pressure checks. And she began to realize that there was a lot more medical needs there. And she sort of set up basically what was a first aid station in a broom closet. As she got to know more and more about the homeless population there, she realized there were more complicated medical needs. And she got Dr. Arthur Bickford to back her up. And the two of them began to visit once a week, using the broom closet, giving Band-Aids, donated pharmaceuticals, drugs that we couldn't get, dressing changes, and most of all, clean, dry socks. That was the most popular thing to give out. And as it got more and more busy, Dr. Bickford approached several physicians to ask them to volunteer. At the time in 1980, this was in the 80s, and in 1988 I was the medical director of Cape Cod Hospital. So I got involved in helping to set up a roster of volunteer physicians who would help back up the nurse at Noah Shelter in the broom closet. And there was a number of volunteer physicians, many of whom had already had experience volunteering for a free clinic for sexually transmitted diseases. Oh, okay. So there was a history there in the medical staff of volunteers. And as things get more complicated and there was more and more needs, we graduated from a broom closet to a room and half a hallway, and then basically to 2 rooms. And Susan Duenas, who was working there, then went on to get her nurse practitioner certificate. And when she got that, she remained with the VNA and remained at Noah Shelter, but then precepted another nurse who was going for her nurse practitioner certificate, Judy Best Leviniak. And that's how Judy Best got involved. And Susan precepted her, and then finally Judy Best really kind of took over her role completely. Not completely, but they both worked there. But Dr. Bickford, who was no slouch at recognizing great talent, recruited Susan Duenas away from the VNA to his practice, and she got very busy with that. So then Judy Best really took over.
Okay, and sometimes people say, how did you get the name of Duffy Health Center? And Judy Best Leviniak is a member of the Duffy family, so that's the connection there.
All at that time, we were known really as the NOAA clinic for the homeless.
Okay, and you mentioned earlier the hospital and the involvement of the hospital and the physicians at the hospital, but the hospital, Cape Cod Healthcare, also supported the work of the clinic, right?
Yes. Jim Lyons, who was the CEO of Cape Cod Hospital at the time, was contributing initially just $200 a month. That was it.
Oh.
and to help support, buy some drugs, dressings, things that we needed. No salaries were involved. It was just getting supplies. There were also donations from churches, but the Cape Cod Hospital thought it in their interest to help provide these the homeless population with some services, basically to try to keep them out of the inpatient hospital and try to keep them out of the emergency room.
Right.
That very small amount grew over the years and continues now that Cape Cod Healthcare is quite a significant supporter of the Duffy programs.
Right, right. Through their community benefits program, the hospital provides grant funding for Duffy Health Center. So, Cindy, I always tease you about being employee number one, right? We got parking stickers a few years ago, and we started based on seniority, what your number was on your parking sticker, and Cindy is employee number one. When did you become involved with the clinic at the shelter, and were you a volunteer at first, or how did that work?
I was a volunteer. It was called the O'Neill Health Center at that time, and I actually started volunteering answering phones, which was through Housing Assistance Corporation.
Oh, okay.
And
because they ran the shelter, right? Okay.
They did. And I had worked with Judy many years prior, and she remembered me from that I was, had a nursing background, and I started assisting her with some charting, some outreach. It was strictly volunteer for the first several years. This was like in the mid-90s. And eventually, as they were getting ready to go for licensure, I was sent to do some training to become an HIV testing and counseling.
Oh, interesting. I didn't know that part.
And
okay.
That was my first actual paid position through the clinic.
And so you've seen a lot of change over the past 20 years. Tell us what are some of the biggest changes, bigger changes you've seen on the Cape or that you've seen in healthcare?
Well, I think when we first started the clinic, when I first started working with Judy at the clinic at the shelter, we really did everything. There were no support services at all, and that certainly has changed as Duffy has expanded with the complete departments of behavioral health and case management. I think on the Cape in general, community health centers have taken a much more prominent role. So we now have the Harbor Health and the Community Health Center that's
and Outer Cape, right? Our partner
Cape.
health centers. Yeah.
Right. So that has been a big difference, I think, in healthcare. At the time when we were providing service at the shelter, it was really putting on Band-Aids and doing dressing changes. And I think the change in focus to wellness.
So taking care of chronic illness and those kinds of things.
Absolutely, the chronic disease management has really taken a.
And you still work at the shelter. You still go twice a week.
I do. Yeah. It's a very important part, I think, of what we do at Duffy.
Very good. Very good. Well, talking about the new services that started over the years to support the work of the medical clinic, this is where Claire comes in in the 2000s, in the early 2000s. You really had a lot to do with the development and professionalization of our services. So what attracted you to come to Duffy Health Center?
Well, I came to Duffy in 2003, and earlier, I think in 2002, Duffy had been awarded the very first federal Healthcare for the Homeless grant. So the board was really looking for more of an executive capacity person to come in and manage the grant, which was significant funding and had a lot of requirements regarding reporting and program development. So I was attracted to Duffy for a number of reasons. First and foremost, the mission. I'd spent my career in not-for-profit organizations, but I had never worked with the homeless population before. And I was intrigued by that, and I was extremely impressed by the level of commitment and dedication there was to mission. And I see that today, even as I talk with you about what's happening at Duffy today. The sense of the mission, the belief in the dignity and worth of all people is very present. So that's what really attracted me. And it was still small enough to really feel as if you could help to shape services. And I had my experiences really in program development, and it seemed like a good match at the time. And for me, it certainly was a marvelous match. It was my favorite job I ever had in my career.
So between the two of you, you'll remember when we moved out of the shelter and moved into our first clinic building. What was that like to move into a real clinic?
That was quite a change. And I actually stayed behind at the shelter for another several years.
Oh, okay.
You did.
Along with one nurse practitioner, that there were certain patients that weren't quite ready to make that transition. We had always worked so closely with housing assistants in the NOAA shelter, having the services right there.
Right,
So,
right. So you were their security blanket.
Yes, yes.
So 2003?
2003.
Then we moved into the building.
Into the new building in 2002, and then I came in 2003.
Okay, all right. So what were some of the first things that you saw that needed to be done?
I would say we had to tackle some things in terms of financial management, because this was an organization that had been doing wonderful work without really having to concentrate a lot on what they were doing in terms of billing and
accounting.
Exactly. So we really had to put some different controls in place, and we early on hired the first CFO. He and I shared an office together for quite a while. And that was a good starting point to sort of get us at a point where we could begin investing in additional staff and program development. And then the next big area was really to think, folks were already doing everything, as Cindy said. You know, she was acting as a nurse, but she was acting as a case manager. She was acting as a counselor, as a confidant, as a general support person. And what we began talking about was really looking at all of the presenting issues that our clients presented and trying to figure out a way to address all of their needs in the most integrated and professional way that we could. And so that launched a multi-year strategic planning exercise that led to our exploration of licensure for behavioral health, that led to our development of a real case management program, and an integrated model of care, which I'm delighted still continues today.
That's right, the three-legged stool.
Yep.
Still exists.
Yep.
So we're all involved then in thinking about and planning for our new building that we're in now at 94 Main. I know, because I've read through all the files, that it was a huge amount of work. What are some of the memories that you all have about working on the new building?
Well, I want to jump in on, I think Claire is being very soft-spoken, diplomatic. Basically the 2 years before she came, before we even moved to Park Square, we were seeing 7,000 patient encounters a year. It was a $1 million operation, and it was basically a ma and pa operation, Dr. Bickford and Judy Best. And the switch to Park Street and then Park Square, and then the requirement, we got a federal grant, we had all sorts of requirements, and it was quite a transition from the ma and pa operation to this corporate operation, which was necessary to do the financial accounting and the programming and the advanced planning. Up until that point, we would kind of see a need and provide the service, and then figure out later how to pay for it, or how to continue.
That's healthcare for the homeless.
Or how to continue. And we really, Claire, with the Board of Trustees at the time, really with a great deal of effort, put it on a forward-thinking footing, a more stable corporate footing, with department heads and secretaries and the whole gamish, which was quite a change. And all that was really between 2003 and 2006, and the organization went through that transfer and that turmoil, and came out very nicely organized at the other end, much due to Claire's leadership.
Thank you.
Well, and the natural evolution of not-for-profit organizations follows that trajectory. You have a charismatic leader who starts, and then you have structure and professionalism that gets infused, and then you're positioned to grow for the future. Any thoughts about the building and getting ready for 94 Main and all of that from your perspective? How were the staff involved in that process?
Well, my thoughts of getting ready for 94 Main were, it was an endless search for a place to move to. And it felt like it was never going to happen. Staff that were originally involved in the search for a building was primarily our CFO at the time, Paul Chiswick, and myself. And I can't tell you how many places we looked at in an effort to secure. At this point, we had grown, and we had developed this sort of little campus around our original leased building, and we had 3 separate buildings. And we were, at the time we began looking for the building, at least 50 staff. So we needed a good-sized place, and we also knew we wanted a place that we could grow into, and that met all licensing requirements, and that was affordable, and most importantly, that was accessible to our client base, because we did not want to locate in an area where our clients couldn't find us, or that it would be a barrier, transportation would be a barrier for them. So we looked at multiple locations, and Paul was actually the one who knew the urology practice that owned that land, and we went and talked to them, and they agreed that they would do the build out for us, and we knew we had a limited amount of space in which to design a building. That was the downside. If in the best of all worlds, we probably would have had a little bit more flexibility for a future space expansion, but at this
There's
point,
so many limitations with zoning.
Exactly, between zoning and location,
right.
and we knew this was a good location. It's near the hospital. It's near other services. It was within walking distance from the NOAA shelter.
Right, right. What, anything you want to add to that? What the impact was on the staff?
I think for the staff, it was a very exciting. Probably most people were approaching it with a little bit of trepidation. We had some walkthroughs as the building was going up, and it was sort of almost like children. I don't know, is your bedroom bigger than mine? You know,
Who gets the corner suite?
Right, right. Where am I going to be? But it was a very exciting time.
I think the
all of
thing
us.
people really wanted to be together under one
Right.
roof. And we had our medical clinic in one location, our behavioral health and case management in another, in our administrative offices. And people, you know, were at this point in time, were very interdependent on each other and wanted to be under one roof together. So I think there was that sense of, you know, having a home together that was exciting.
I always say it's amazing how many people you lose just walking across Lewis Bay.
Yeah.
And trying to get somebody from the medical department to behavioral health is now just walking up a staircase.
Right.
So it's a lot more convenient. Well, another thing that Claire is known for in this community is your work in helping put together the Main Street Initiative, and that work continues today. We're still partnering with the Barnstable Police Department and the Business Improvement District for Hyannis Main Street. It's been very rewarding and satisfying work. We're all working as a team. Duffy now has a street outreach worker. A Housing Assistance Corporation has 2 street outreach workers that work very closely with the police. And any thoughts about how that kind of all got started? And you're a resident of the town of Barnstable, and you know the changes that have happened kind of over the years with the blossoming of Hyannis Main Street. It's wonderful.
It is. It was a great initiative from the get-go because it was a community-based initiative. You know, that the same people that you're talking about now as participating were those who participated. I have to say the Barnstable Police Department was critically important to us at the time. They had, I don't know if they still do, had 2 female officers who really knew our population very well, and the chief of police was very open to working in partnership with service providers. And so we did sit together, and you know, it was not without contention because there were some issues related to people seen as transient and within local businesses, but I think people approached the project in good faith for the most part, and you know, I'm thrilled to hear that there's that level of outreach because that was a big missing piece for a long time. Not having enough people out on the street to engage people and to bring them into services. Most people are not going to find their way on their own. They'll come in with a friend or they'll come in with a professional that they trust. So that's wonderful that the initiative continues, and I think it will need to continue. You know, we're coexisting in a small tourist community, and it's great that the same community members are still trying to brainstorm ways to better integrate people that we serve into the greater community.
Right. You know, Hub, earlier, I guess it was last year, we put together a committee to work on expanding our presence in substance abuse treatment in our Suboxone program. We now have about 320 slots, or 320 patients. We have the capacity to have about 460 patients. As a physician working here on the Cape and an honorary board member of Duffy, how do you feel about how that's all evolved, medication-assisted treatment?
Well, unfortunately, it continues to expand. The patient need is there, but the medically assisted treatment of heroin addiction is a very effective treatment. It's an outpatient treatment. People don't need to go into the hospital to start it. No one has to lie down in a bed. It's all outpatient. It is at Duffy. It's coordinated in time-wise and program-wise with the behavioral health treatment, which is most important. And it's proven very successful at other venues, and it's proving very successful in changing the addictive behavior. There's a lot of controversy about, oh, we're just switching one drug for another drug, but in fact, with the Suboxone treatment, the addiction behavior, the antisocial and the problem behavior of using heroin goes away. And Suboxone allows people to be fully functional, allows them to work, and it's like a diabetic who needs insulin. They go and get their Suboxone on a regular basis. And at the same time, now at Duffy, that they come in for the Suboxone and have a medical evaluation, they are meeting in behavioral therapy groups, which have been most helpful.
Yeah. So it's about time for us to wrap up. I wondered if you had a favorite story about a client that you'd like to share, or if there's a favorite memory on the part of any of our panel.
It's really difficult to come up with one
I bet.
favorite story. I have lots of stories. But I think probably one of the ones that has touched me the most and made the biggest difference in the way that I deliver care is in the very beginning, I received a phone call at like 2 in the morning from the Pine Street Inn. And a resident at Pine Street had passed away, and I had been listed as his emergency contact.
Oh, wow.
And I wasn't aware of that. And it really was a very humbling experience. And I've carried that with me, and I'd like to think it makes a difference in how I relate to.
You know, one of the
to
first
all the
experiences that I had as CEO at Duffy was going to a meeting of the Council of Churches, and Billy Bishop, who founded Homeless Not Hopeless, loves to tell the story about how Cindy Glista used to chase him through the woods.
That's right.
He said, until one day I let her catch me, which is just what happens with our clients.
That's
All of a
right.
sudden, one day, it's that constant engagement, it's that constant outreach that really works over time. It really works. So thank you all so much
Thank you.
Thank
for
you.
being here. I wish we had more time
Yeah.
to keep talking. Cindy Glista, RN at Duffy Health Center, Claire Goyer, former Executive Director of Duffy Health Center, and Dr. Hub Mathewson, Honorary Board Member and Pediatrician. Thanks a lot for being with us, and we'll see you next time.